we just brought a baby home.
We did.
Again.
Yes. Number 2.
And so this week we're going to be sharing all about that first day home, things you need to know for baby.
And for mom.
And for introducing your new one to kiddos you may already have at home. Just in case this is your first time meeting us, I'm Kurt. I'm a board-certified pediatrician.
I'm Sarah. I am a board-certified OBGYN,
and we are the Doctors Bjorkman.
So they let us leave the hospital. It felt a little bit, again, like we were stealing a baby when we left.
Surreal.
It's very, very weird after being in the hospital and, you know, you've got a wristband and a baby's got a wristband and an alarm and all these things and you're constantly being checked on and all of a sudden they just say, all right, you're good to go.
Yeah,
and
we trust you with this new human life form.
Right. Good luck. And you put them in their little car seat and out you go.
Yeah.
And you're on your own.
And so, like, a little reassurance for you is, like, as parents, you're equipped by nature to do all the things.
Yes.
It is going to be hard.
And scary.
And scary. That's okay.
But you can do it.
And so, just starting out, we're going to start talking, as we mentioned, talking about things for baby that first day, things for mom, and then kind of introducing to big siblings.
Yeah.
For baby, really,
the
biggest thing to think about for that first day home is just feeding, right? Like, feeding is the biggest part of their life for the first couple weeks of life.
Right. Make sure they pee, poop, eat, sleep. That's their life.
Yep, and the thing that takes most work from you as new parent is making sure they're eating and eating often. I think it's really helpful to realize, like, how small their stomach is when they're first born. Like, just, it's tiny, the size of the end of your finger. And so this means they have to eat often to fill that little tummy up, and that tummy's going to grow and stretch over the course of that first week. But it just means they need to eat often, and they may not stay full very long. This is why sometimes they're going to cluster feed and want to eat every hour, it seems like.
Or more. The whole, like, every 2 to 3 hours feeding is not really a thing, if you're breastfeeding, at least in those first days and weeks. And we'll show kind of a picture. When I am breastfeeding in the beginning, I keep track of things on an app. The app I like is called Huckleberry. There's tons of different free apps you can use to track nursing or diapers or whatever you want. But you can see the orange bars are the times that the baby was on the boob in the first days, and it's all the time. All the time. It is not, every 2 to 3 hours. It's like 3 times in an hour. And
which really serves a couple functions. The one is, like, it gives baby lots of practice to learn how to latch.
Right.
It's helping them, like, grow their little stomach and get the calories in while mom's milk supply volume is
established and establishing those prolactin receptors, and you're telling your body, your baby's telling your body, this is what I need to establish a milk supply, get that milk to come in, because in the beginning it's just colostrum, that liquid gold.
Yes.
And so it very much sometimes feels like your baby's not getting enough, but just
they are. Like, this
it.
is the way baby and mom are designed to do this, and then like baby comes out with some extra fat stores. Like, we anticipate them to lose up to 10% of their body weight in that first week of life, and this is just that transition period.
And why the pediatrician likes to see them early.
Yes.
Kind of 24 to 48 hours after discharge, just to make sure things are going okay in terms of weight gain and all that stuff. So you have a teammate, not just you as parent watching, trying to figure out if it's all okay. Your pediatrician is your teammate, and they want to see you and make sure things are going okay to check on baby and to check on you.
Yep. Other things that we mentioned, because feeding is such a big issue, like, have a low threshold to reach out for help if you need it. And so it's good. We've recommended seeing a lactation consultant while you're still in the hospital before you leave, if possible. But if you're having struggles, talk to friends or get a hold of a lactation consultant, or even it's a nice place to check in with your pediatrician at that first visit.
May have resources, or even sometimes they have lactation consultants that come to their office. So something to think about on that front.
Yep. Other big things for baby during that first day home is the result of all that feeding is peeing and pooping, and so you're gonna get lots of practice with diaper changes. Expect maybe kind of 1 bowel movement first day, 2 the second day, 3 the third day, 4 the fourth day, and then for many babies in those first couple weeks it ends up being a bowel movement with every feed.
Yep.
And some babies end up pooping once a day or every other day even. That's normal too, but it can be normal to have it, and is very common for it to come with every feed. And so So you're gonna get lots of practice. As partner, I feel like this is kind of my time to shine in terms of she just did the work for 9 months. This is my time to finally contribute a little bit towards care of this baby. So
other thing is sleep, of course, and can be scarce in the beginning. Baby has been, all snuggled up in your womb for 9 months, and now they are out in the world, and they really still want to just be snuggled up with you, and they're really, really sleepy in those first couple days.
Yeah, even like sleeping, anticipate more than 20 hours of sleep a day in those first couple of days of life, and so just anticipate they're going to feed, and then they're going to go to sleep. Like, you don't anticipate them being awake for a long time, and their awake windows are going to be really short in the first week or two of life. So
that being said, you want to make sure you are waking your baby up to offer them food, either a bottle or the breast, every 2 hours, every two to three max, because they are so sleepy. Some babies are really sleepy. They may not wake up. And so, you go a 4-hour stretch during the day as they slept, and then you feed them, and then they go another 4-hour stretch during the day, and then you feed them, and then you will find yourself up in the middle of the night because baby's trying to catch up on all that they didn't eat during the day because they were so sleepy. So there is that old saying, never wake a sleeping baby. Great saying, gotta tweak it. Never wake a sleeping baby at night when they're a little older.
But during the day, and this is something we were very intentional, like during the day, making sure baby is exposed to natural light, wake them up often to feed, and this really helps them get used to that 24-hour cycle of daytime wakeful periods and sleeping more at night. That's going to help you be parent caring for them. So
because in the beginning, days, nights, they
don't mean anything to them.
Very confused to those little ones. So you can help them by waking them up during the day, keeping them in the sunlight.
Yeah, the more you do that daytime waking, more like really focus on feeds during daylight hours, it's going to pay off and help that transition sooner rather than later.
Yes, and other things people are kind of thinking about or wondering is, like, can I spoil my baby? Can I hold them too much? Absolutely not. Yeah. Don't worry about sleep habits at this stage of the game. This is a snuggle your baby, and don't worry about sleep habits. Those first kind of 4 weeks are all about survival.
Yes.
And so enjoy all those newborn snuggles. If sometimes baby will fall asleep on someone, and make sure that if baby's falling asleep, like sometimes Bo would fall asleep on Kurt's chest, make sure the other parent or a caregiver is there to watch and keep an eye on that.
Because you're going to be tired, and so one of the most dangerous sleeping places is baby sleeping on a parent in a chair or on a couch in terms of risk of sudden infant death. And so it's bound to happen. Right. And so just make sure that you as a team are keeping an eye out for one another. If one of you falls asleep holding the baby, making sure that you're in a safe spot. And if not, bring them to a safe sleep.
Yeah, safe sleep, again, is
flat on their back in an empty crib or bassinet. No extra blankets, bumpers, toys, things like that.
Yes, and we love swaddles, big fan of swaddles. They've been all scrunched up, cozy in the womb, and so they really like that. We have a video all about swaddling. You can check that out.
So, day 1, home with a sweet new baby.
Day 1 home, morning 3 of life. So we're just 50 some hours old. Just kind of cool to be able to be home so fast. Things went so well.
Yes, we got lucky there. So we're home. It's great to be in our own bed with some of our stuff. Newborns are still a lot of work.
Yep.
And then you add a toddler, and it keeps it very interesting. So
yeah, thankful to have family here helping us wrangle for the first couple days here. But
so
how are feedings going for you?
They're going. We're still waiting, trying again hard to breastfeed is our goal. And babies are learning how to latch. They have to learn how to eat too. You think it's something that's just so natural, or you see it and it's oh, you just know how to breastfeed. But at least for me and my little babies, it takes a lot of work. We're working really hard on getting a good latch that's deep enough that doesn't make my nipples hurt, and so working very hard on that.
I think something that I'm surprised about this time so far, the other piece is it takes a while for milk supply to pick up, right? and usually it takes 3 to 4 days at least for full milk supply to come in. And so, I guess I knew this, but even in the back of my mind, I'm like, oh, second time, the milk's just going to be flowing, open tap, but
No.
not the case yet.
No,
So
still waiting on that. And with milk supply, it kind of goes not enough, too much, just right.
Yeah.
We're in the not enough phase. We're just waiting on
Volume.
the milk supply to really come in. Right now it's colostrum, which is great. Baby's tummy is tiny. That is all they
so
need.
it is enough. It just doesn't. It's not the big volumes. It is really highly packed with nutrients and
Liquid
antibodies, and so it is enough. Baby has lots of fat stores on board to make them through the first couple days, but the volume isn't there, so it doesn't give them that fullness, satiety
So they want to eat all the time. Cluster feeding is normal. Every hour from 10 to
10 p.m. to
4 a.m. Last night we were on the boob, and that's okay.
Yeah. But that's exactly what he needs to learn how to feed, what Sarah needs for her body to sense that it needs to produce more milk.
Body says,
and as Sarah said, the stomach starts out really small, maybe the size of the end of your pinky in the first day, and then it's going to grow and expand as it starts to get food in, it stretches, and so they don't need a ton of food the first couple days, but as the milk supply comes in and as they're able to get more volume, it does help with fullness.
Yes. So we are actually just about to head to the pediatrician.
Yep.
The AAP really likes to see you within 24 to 48 hours after discharge, just to make sure things are going well. Get a weight, kind of check in and see. So we're going to go do that next.
Yeah, part of our full first day home.
Yes.
So that's all the baby stuff.
Yeah.
The other part of this pair is mom stuff or birthing parent stuff. And now you're home.
Yeah.
You are not in the hospital anymore. Whether you had a vaginal delivery or a C-section, you are a warrior and just worked so hard to bring that baby into this world. And now you're at home and you don't have people kind of there bringing you things, bringing you your pain meds every 4 to 6 hours, doing some of the things for you. So what I see, with myself and with patients when they go home is they tend to do more than they were doing in the hospital. You get up to go to your refrigerator, you walk farther to your bathroom, you go upstairs to your bedroom, all these different things. And it's more than you're doing at the hospital. So you may find that your bleeding increases a little bit. You may notice that your pain increases a little bit. And so things I so encourage on that first day home is to rest as much as you possibly can. Let people take care of you. I think having help in those first few days is really awesome. If you have a partner, really lean on them. If not, this is a time to kind of call on your village to be there and help you because it's a lot. And so as much rest as you can. Let people bring you the baby. Let people bring you your pain meds. Let people bring your food, water, all those things. You just did an incredible physical thing, again, whether you had a vaginal delivery or a C-section, and you deserve to continue to rest and heal.
Yeah, I think it's good, just as much as we were talking about schedule for baby, is thinking about schedule for you in terms of making sure that there's always water at your side, that you need to stay really well hydrated, stay really well fed. Now is the time to make sure you're getting those things in. It's not the time to cut back on that. And then making sure, like you said, pain meds are scheduled too. And so as partner, these were things that I tried to be intentional about, and hopefully I did okay at, in terms of making sure you had food regularly, had water, and we're taking those pain meds every 4 to 6 hours.
Motrin and Tylenol every 6 hours. If you had a C-section, you may have some kind of narcotic pain medication for a little more. And something else that some C-section mamas and other mamas really like in those early postpartum days is an abdominal binder to kind of support that your abdomen, your really weak core, or if you have a C-section, you just, again, had major abdominal surgery, and so that can really help with the support.
In terms of how much to carry, the weight of the baby, is that about the most you should hold? Or
no more than 10 pounds, about the weight of the baby. Especially if you've had a C-section for those first 6 weeks, because we really want that all to heal as well as possible. In terms of everything else, so you all know I love nipple care if you are breastfeeding. because, you know, we talked about how much baby's going to be trying to nurse and cluster feeding, and that is really hard on the nips. So, you know, nipple butter, lanolin, whatever your preferred nipple care is. I really liked Silverettes. I keep those on my nipples 24/7, except when the baby is nursing, and feel that they really, really help promote moist wound healing, help the nipples recover from, you know, baby's intense little latch. If, you know, you find that breastfeeding is super, super painful, again, that is a red flag to get some help, because you might be having latch issues, often a shallow latch. When babies are little, they have the little jaws and they're learning to get their mouths wide open. Latch is a very challenging thing. And so if breastfeeding is super painful, like clutch your partner in tears, painful, not getting better, you'd rather give birth again kind of pain, I have been there. Red flags, see lactation, get some help, because you don't want to do a lot of nipple damage and be in a tough spot to, you know, we don't want nursing to suck. So nipple care, well.
Pun not intended.
Pun not intended, clearly. Nursing sucks, but other thing, wound
Bar
care.
for humor is pretty well.
Yeah, we're tired. Bottom care for mom.
Yeah, I felt like this is something that was maybe different between the two times. Like, I was very surprised when we brought our first baby home, like just how uncomfortable you were even standing for long periods of time.
Gravity, man. I really truly felt like my vagina might fall out. You like just felt gravity anytime I stood up and was like, wow, this is not fun. And so continue when you're home, kind of the things that you hopefully started in the hospital, using those ice padsicles a few times a day to help with inflammation. Again, taking your pain meds. Dermoplast is a spray-on lidocaine that can help. Witch hazel pads, all these things. We have a whole video about perineal care, and so definitely keep up with that. Sitz baths. Now that you're home, you may have a bathtub, and so you can get some Epsom salt. And you can sit in that bathtub for, you know, soak for in a little bit of water for 10 or 15 minutes a couple times a day, and that can really help with, you know, promoting good blood flow and keeping things clean and all that. So those sitz baths are wonderful. Abdominal care, if you had a C-section, again, for the first 24 hours, there's going to be a bandage on it. If you're home after your C-section, it's usually day 2, 3, 4, 5, you know, you have to stay in the hospital a little longer. So after 24 hours, for the first 24 hours, they want to keep the bandage on that incision and keep it really clean and dry. After 24 hours, the bandage comes off. It's okay to take a shower. You can, and we want you to keep that incision clean. Just kind of let some soap run over it, and then when you get out of the shower, pat it and keep it clean and dry. Often you'll have some steri strips, little white kind of band-aids that are on to, you know, help approximate and strengthen that. Stitches, usually it's stitches. Every once in a while you'll get staples, and just try to leave those be. Don't pick at it. They start to fall off after about a week or so, and when they start to fall off, then you can take them off. So those are key mom things. Other key mom things is you're really tired. This is a new thing. And so mood and where you're at. One, know that it's totally, totally normal to like be very emotional. It's a big hormone swings. It's sleep deprivation. It's so much joy and love in this new little thing. But postpartum anxiety, depression, all real things. And so if you feel overwhelmed, you're not enjoying your baby, you feel unsafe, unwell, talk to your partner, talk to your doctor, call your pediatrician. If you feel like you need help, you feel like hurting yourself or your baby, reach out to anyone for help. I definitely cried over things that I like normally would not.
Or even like anxiety, fear about like dropping your baby or tripping while carrying them, or like...
Yes. So I'm like, I didn't wear socks that first day because I felt like I was slippery, and I was like, what if I fall and drop the baby, or even coming around a corner and I'm carrying him, what if I hit his head on the counter? And like these little bits of postpartum anxiety that are like within the realm of normal, but that can spiral pretty quickly. So yes,
if you are noticing these, get help. Like,
Yep.
no one is going to judge you for reaching out for help.
Right.
This is unfortunately common, and that's okay. And there are systems in place to help parents go and deal through with this. And then the final piece for this part of our saga is introducing new baby to siblings who are at home already. I would say the biggest part that like has helped us in our success of this transition was really preparation that happened in the month or two before baby. This was lots of talking about new baby coming, looking at mama's belly, saying where's baby at. We read lots of books, as many books as we could
Those are
about
awesome.
being big sister and having a little baby at home. Talked a lot about being helpful for baby, and that thing I think really just helped prepare big sister to meet little brother.
Yeah, your toddler wants to know everything.
Yes.
And things that are unfamiliar to them, you can kind of make familiar by literally just telling them everything's going to happen. The baby's going to cry a lot. Baby's going to get a bottle many, many times a day. You can help mom with the bottle.
And diapers and all of those things.
Here's where we're going to keep the diapers. You are going to stay with grandma and grandpa when we go to the hospital to get your new baby. All these different things, just constantly talking about it. Reading different books about being a big sibling and all, you know, or when you see things on, there's even episodes on TV like Daniel Tiger is getting a new sister today, you know, different things where you can say, that's going to be you. We're going to bring a baby home for you. And so that's a really big one, was trying to make it familiar.
Yeah. And then on the day of, there's some things that I think we were tried to be intentional about, like even first introduction. I think it's really tough because you as new parents are so focused on the new baby and realizing that like it needs to be, you still have just as much focus on the baby, the child you already have at home.
There used to be a number one, you
Yes.
know, and having all your attention, at least if it's, you know, it's baby number two.
And so something we did, so we got home, had Sarah come in first and like see Cecilia, talk to her, and then like I brought baby brother in kind of later so that then she could have almost like a neutral meeting of him where she got to see her parents first.
Yep. And they kind of recommend that you do that, like have your attention on your first kiddo and then try to have them meet baby in like a neutral space. Like not even not holding them was one of the things we did wrong, but like having them in a bassinet or a little rocker or a crib so they can go over to that space and it's not like mom and dad have the baby and we're jealous of that. And so that was something we like half did. I went in to see her and then you brought him in.
Yeah. Also like thoughts about having baby bring a present for the older sibling was something that we did. Like we both like had Cecilia pick out a present for her baby brother before we left, which was fun because then she like right away said, Bo puppy. She like went and got the present she had picked out for him
and brought it to him as soon as he got home.
It was very sweet.
Yeah, because we said, oh, see, we'd gotten her some things from her brother ahead of time. We said like, this is for you from your brother.
That we brought home on the time. Yes.
And we said, well, Cease, do you want to pick out a present for Bo when he gets here?
Yes.
And we were at Target and said this, and she said, Bo puppy, or puppy Bo. And so we picked out the little dog stuffed animal and you can see it. It was very sweet.
Yes.
So that's something else that they say, you know, gifts, you know, as something everybody loves, presents.
Yes. And then I think one of the other things that we've worked really hard on is just about language, because you now like have someone else that's pulling your attention kind of in a very immediate way. You've got a baby who's crying and learning how to balance that, both from a like, hey, we can't go to the park because of baby, is then you're blaming baby and really trying to not blame baby for things you can't do. And say, hey, we can't go to the park right now. We're going to go to the park tomorrow or
like,
later.
You know, if you're feeding the baby, you don't say, I can't come right now because I'm feeding the baby. You say, I will be there in 5 minutes, or different things, trying not to, again, like you said, blame baby for why we can't do things that your other kiddo wants to do.
And also the other side of that too is that it is okay that if baby is crying, baby is allowed to cry for a couple minutes while you attend to the immediate needs of your older child.
And again, use that language, and again, this is for your toddler, of course, but you say, baby, you're okay. You're okay. I will come help you in just a minute. I'm helping your big sister right now do whatever.
Yes.
And baby can cry for a hot second.
Yeah, which is like a learning process that, like, you know, big sister can get attention, even though like it seems like little baby has attention too. Like,
Right.
again, making sure they're safe and like it's not an actual emergency that you need to tend to.
And your toddler hears you telling baby to wait for a second.
Yeah.
And that is important in terms of, you know, harmony, I
Yes.
think. So we'll let you know how all of this
Yeah,
goes.
we'll give you guys some grace because we are definitely not perfect at any of this.
Yeah,
These are
we're
things
figuring
we're
it out. It's just
trying
the
to
first-
being intentional
Yes.
about. I
And
think
what all the, you know, parenting blogs recommend are trying some of those things.
So,
good
I
luck.
will say, like, it is such a joy though to watch your older child love on their new sibling. Like, it's like this whole new level of emotions that we're going to get to share more with you as we go through this. But it is just what a wonderful thing to see.
Yes.
The kids that have been the thing you've loved most in life now share this love you've given them with their new sibling, and it's just such a really wonderful thing.
Yeah, it's really special. So if you are about to bring home a new baby, we wish you the best.
Yes.
Hopefully these little tips help you on your first day home. Plans coming up for next week are kind of to...
We're going to talk all about the first trip to that
we're
pediatrician that's
gonna-
recommended for those first couple
Right.
days home.
We are going to kick off the newborn series with the first trip to the pediatrician.
Also talking about some mom care things, and then kind of a vlog of our first week
of
home
our
as
first
well.
week and baby's first
So
week.
we're going to share kind of our journey and then our expertise along the way. Hopefully it's helpful for you guys and you enjoy it too.
See you next week.
Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.